Dr. Nick said the cast is off, the boot is on, you're ready for therapy. Hey, where can I go for therapy? Dr. Nick recommended Momentum Physical Therapy because they are one of the great facilities around this area that also offers transportation. I have been with them now for several visits, and Trisha Mitchell and her staff have done a tremendously great job in helping me get ready to go, get me going so I'll be able to get rid of the boot and get walking. The rest of the video, part 4, dealing with therapy, is going to cover a variety of different types of exercises that the staff has run me through in terms of getting my foot ready to go so I'll be able to walk again. I'm grateful for their help. I hope that the video shows you several different ideas of things to think about if you have the same type of Lisfranc injury to the foot that I have had, and some of the therapy that these kind of talented individuals will provide you to help you get back on your feet. Oh, literally.
And you're just going to gently meet my pressure. We're going to hold an isometric contraction for 5 seconds. It's the first phase of strengthening your ankle again. Same idea. Now you're just going to push out into eversion and hold. You're going to pull your foot up toward your nose into dorsiflexion, and same thing. You're going to hold 5 seconds. Pressing down into plantar flexion. Same thing. You're going to push down toward the floor. Hold 5 seconds.
So what we're starting to do on the foot here is we're going to be stretching out her toe and her ankle. Given that she was in a cast for 6 weeks, her big toe has gotten very tight. And in order to walk, you need to be able to extend your toe to push off the ground. So we're going to stretch out the toe a little bit here. And then after that, we're going to start stretching out the ankle so that she can regain her forward-backward motion that's needed for walking and her side-to-side motion which is needed for balance. Okay, so next we're going to do some strengthening exercises. Because she's not allowed to put weight through her foot yet, we can't do anything really aggressive on the ground, but we can start with a very light rubber band to help strengthen her calf and ankle muscles. So what you're going to do is go ahead and pull up towards you. As far as it'll go. Good. And we're going to do 20 of these. So now she's going to continue with some strengthening exercises, pulling your foot inward. Good. And again, this is these side-to-side directions are important to have strength for balance.
So you're going to try to use your toes to pick up each rock and put it back in the cup. This is going to strengthen up all the tiny little foot muscles that help support your arch so that when we get you weight bearing, your arch is ready for it. Well, we're going to do ultrasound. I'm only going to keep it at a pulse low setting just to help heal the scar site. Alright, so we are setting up your electrical stimulation. The setting we're putting it on is basically just to help reduce pain and swelling. So it just goes as high as you want it. It's kind of arbitrary what number you have it at, just whatever feels good.
After they put the electrodes on your foot, it gets hooked up to a machine. Then they wrap the foot with like an ice pack that keeps the foot cooler. But what's going on inside, if you look at this machine here, is that they've got voltage going through the foot, which helps reduce some of the pain and some of the swelling. And as you can see here, I'm set at 31 volts hopping through my foot. It was tingling. I'm sure there's more therapy to come, but that's kind of a short version of where we are at this time. Thanks for watching on Lisfranc injury to the foot. Bye-bye.